makes you so sick at heart that you can't take part. You can't even passively take part.
One of the saddest reflections of the state of the world that we live in is the fact that even in the midst of the biggest pandemic of the last 100 years, and arguably the biggest health emergency in human history in terms of the economic costs, the rules of capitalism could not be suspended, not one bit. Not a single vaccine has been provided for global use without intellectual property protection. And, well, now we have news that a new and potentially groundbreaking treatment will also be offered entirely at a price determined by the market. Now, let's understand, vaccines are, of course, very useful. They are the first line of defense against the virus. However, the sad reality is that the Delta variant, that is currently the dominant strain in the world, is highly resistant to vaccines in terms of preventing infection. The vaccines are still great for preventing hospitalizations and deaths, but the fact of the matter is it still doesn't manage to keep you from catching the virus in some form and subsequently transmitting it. So there needs to be more than one line of defense. And ideally, it would take maybe, at least another year to develop or tweak existing vaccines so that they effectively work against Delta. So ideally, we would want a treatment so that when people fall ill, they will hopefully not get sufficiently ill that they might need to go to the hospital, or worse, that they die. So the combination of vaccine plus treatment would really be the only way in which we can end the pandemic. Not end the virus, that's not going to happen, but end the pandemic in the sense that almost everyone could live a normal life, being relatively free from worry that even if you catch COVID, that you will get something not significantly worse than just a bad flu. So, this new treatment is developed by Merck, which I should add is the company that developed a certain horse dewormer, which for some reason people don't seem to think that that's part of Big Pharma as well. But anyway, so Merck has developed a treatment called molnupiravir, and they are going to sell it at 40 times what it costs to make. So this drug, which again the results from clinical trials have been absolutely outstanding. I think in the cohort that they studied that got the drug, no one died, and a much lower number needed to be hospitalized. So the numbers were very encouraging. And apparently it's obviously hard to really estimate how much a drug costs, but apparently $17.74 for a 5-day treatment using this pill. Except, how much are they going to sell it? $712. That's insane. That's what they're charging the US government for this treatment. And, well, there's a big problem with this because they received government funding. So they received apparently a 10 million grant first, and then 11 million in additional grants. So a total of $29 million US public money was provided to Merck and Ridgeback, the two companies which are developing the drug. And yet the government just doesn't have any say in how much they're actually charging. And, in June, the government signed a 1.2 billion contract with Merck to supply 1.7 million courses of the medication at $712. Yeah, that is crazy. And that is a fundamental problem. And this is a critique that is long-standing in terms of the money that governments provide private companies, especially in the healthcare industry, where these kind of arrangements are more common. So, how would this work That's, we're in capitalism. We live under capitalism. And the fundamental way in which capitalist investments take place is in terms of an equity stake in what you invest in. No investor is going to invest in a company without receiving an equity stake. That's a fact. If you watch shows such as Shark Tank and Dragon's Den, however they're called around the world, always the offer is a share of your company. That's the equity stake. So I don't know how much the total development costs of this drug were, but clearly that 29 million that the government provided is a stake in that drug. And so by having a stake in that drug, it should have some voice in determining its price, its final price, and two, and this is I would say also equally important, how much of the profits of that drug are actually going to go back to the state, because the state provided an investment, and they should get some of the returns as well. Again, these are not my rules. These are the rules of capitalism. And otherwise, this is charity. The money that the government has provided, Merck and this other company, Richback, what's it called? I think so. It's just charity, with no say in what the taxpayers would have wanted. And at the very least, I think in a country like the U.S., there should be some negotiation of drug prices. Like, you can't just leave it to the market. And so apparently they've already done some agreements with Indian companies who are going to price the drug at less than $12 for a 5-day course. So you can tell that even the cost of producing it might even be less than 17 if you're doing it abroad. In the US, and likely in many upper middle income and all high income countries, the price will be determined by the market. Now, this is a bit of a misnomer, because there is no market for this, because there is only one drug that is an effective treatment for COVID. So essentially, we don't have a market yet, in the sense that there's no real competition in terms of how two similar products could compete against each other, and therefore these companies would have to accept pricing it at a market rate. As it is, this is basically a monopoly. There is just one seller of this drug because there's only one drug, and they can set the price as high as they want. But this observation is really good. Offering someone a $700 treatment when they don't yet feel that ill is going to mean that a lot of people are not going to take it. And this is hugely important in terms of its overall impact at that price. Because let's be honest, the people who get seriously ill from COVID is a bit of a coin toss. You don't really know. I have had stories of a neighbor of a friend of mine in the Netherlands who was something like 100+ years old, caught COVID, and it was basically just no worse than a cold. And then you have people in their 30s and 40s who die. So it is a bit of a coin toss, and people can be really ill, like not ill enough to go to the hospital, but still kind of ride it out. After a couple of days, you're absolutely floored. You can ride it out, and then you're fine again. Whereas others just descend really quickly. They deteriorate really quickly, and next thing you know, you're on a friggin' ventilator in an ICU bed. So it is a bit of a coin toss. It's not. There is no knowledge. When you start feeling sick from COVID, you don't know what the outcome is going to be. So how many people who don't exactly have $712 to spare are going to immediately, once they fall ill, are immediately going to buy these pills, the 5-day treatment? I think a lot of them, because the price tag is so high, are going to take a bet on their lives. And that will seriously dilute the impact of this drug among working class people and poor people. Because really at that price, only certain middle class people and above are going to be able to afford it. Certain people, I guess, at ages where they might not feel that they're vulnerable, might might not take, like, I would think twice if I caught COVID. Well, I'm vaccinated, so I'm not really worried. But I would perhaps think twice if I caught COVID and started feeling like really, really bad. Not bad to go to the hospital, but still pretty bad. I think twice if just spend $712 for something that I might not need. Uh, I don't know. This is just bad politics, and bad economics. But that is the way seemingly the world works. And like I said, this is a recurrent problem in every type of government spending on new development, and especially in terms of medical research, as well as other types of scientific research. The government never gets anything back for the money that it invests. It is essentially a game of charity. And it's, you can argue that overall, people are better if this pill exists than if it didn't. And that is true. But that still is a sign of governments under capitalism deliberately tying their own hands and not doing anything that could give them back some of that investment. And that is, like I said, this is not an oversight by the government. This is not that people are too stupid to realize that they could have a say in this. It's deliberate. That is the model. That is part of the model. That's how things work. So the phrase socialism for the rich, capitalism for the poor. This is the greatest example of this, because this is fucking socialism by their own admission. Free money. This is free money for Merck and Ridgeback to develop a drug and then have no responsibility whatsoever of giving a single dollar back to the state, aside from whatever they pay in taxes. And so my simple proposal for situations like this is that every public investment be treated as equity. That would be like the simplest way in which you can solve this problem. By having an equity stake, whether it's in the company or treat each drug or each new development as a separate entity, the government would get some of its money back, get an equivalent to its investment in terms of the profits that it would get back to it, and two, have a voice and say, you know what? When we make a deal, when we make an agreement in which I will invest money, I will determine what is the maximum amount that you can charge for this. And there have been observations, I think in this piece, that they could sell it for $19.99 and still get a 10% profit. Heck, go higher than that. I think most people in a country like the US or in the Western world could easily pay $50 for this. That's a huge, huge profit margin for Merck and Ridgeback. Something that costs $17, selling it at $50, that's pretty damn good, I would say. And $50, I think almost everyone, you would have to be very, very low income to not have $50 to spend in like a potentially life-saving investment on your part. So $50, that could be the best $50 you've ever spent. But yeah, that is capitalism for you. And yeah, I just want to re-emphasize something that I said at the very beginning of this video. Merck is the company that developed the horse dewormer, okay? And I know that it's now generic and, everyone can buy it without giving money back to Merck. But just a reminder that too was developed by Big Pharma. So this is my message to the left anti-vaxxers, the Jimmy Dores that might potentially see this video. They're part of Big Pharma as well. So yeah, sad story. I hope it's made available at a better price. And if you like this video, please like, please share. Most importantly, please subscribe. And I'll see you next time.